This is a drug that had been approved 20 plus years ago. There had been some modifications and changes to the accessibility in more recent years, and especially during the pandemic. And it is into that environment that this case comes. And I was actually going to ask you, in 2020, medication abortions accounted for 53% of all abortions in the US. New data from the Guttmacher Institute just this month found that that number has increased, proportion has increased to 63% of all abortions in America are medication abortions. How does that increase, how does that statistic affect this case and how it is received?
Yeah, it's a great question. I think that, again, the goal of these far-right conservative groups is to prevent any abortions from happening in this country. So I think that the increase indicates two things. One, that people are still going to get abortion care. Like, it's a tale as old as time. Like, if you look back to the 1800s, if you look back to the 1950s and the Janes, like, people will find their ways to get abortions. And without access in certain state person care, because the provision is banned in those states, people are finding other ways to get pills. And sometimes that is driving across state lines and mail ordering a pill. Sometimes that is getting a pill sent into your state. There are protections in at least 6 states in this country for healthcare providers. They're sometimes called shield laws. And those laws basically protect the providers in those states, so such as New York, California, and 4 other states, including Colorado, where if you're a provider and you mail pills into Texas, while you can't control what Texas is going to do, New York will say, okay, well, we're not going to comply with out-of-state law. So those laws have also led to an increase in the numbers of recipients of pills. But overall, I think those numbers indicate that users and patients have a good experience when they use the pill, that it's safe, it is convenient, it is more private, and it's, again, 97% safe and effective. That's more safe and effective than a Tylenol or a Viagra. So I think that's why we can reasonably see that increase.